everyone. Hope everyone had a great Thanksgiving holiday last week. We're back here, back to work, and none other than our wonderful patient. She came all the way from India. And so the purpose of the trip was to travel for the surgery, and she'll be heading back home tomorrow. So a warm welcome to the many new listeners, to new members on the Facebook group page, Instagram, TikTok, and Instagram. So please feel free to ask any questions. This is again what I mentioned previously, a movement by the ladies, for the ladies, and this is where we want to empower and share information and knowledge, something that is concrete and defined, if you will, so that as you go into any case, and certainly yours, we can see as we look back, you did your homework from another part of the world. I remember it was not too long ago that I talked to you, that you had mentioned, I asked you what % chance do you think you have breast implant illness, and you mentioned 110%. And this is certainly very much consistent with what we saw clinically in the OR as far as inflammation. The other thing I want to mention here is we take care of a lot of our international patients from Europe, from other parts of the world, from Africa, from Egypt. And we help facilitate right to the US consulate and the embassy in New Delhi. This is where we give you the paperwork so that you get the expedited clearance to come here from what is medical tourism, if you will, so that if you ever need assistance with that, we are here to help and guide and assist. And Mar, she's our international representative as far as helping facilitate these exchanges with the US embassies and the US consulate. So having said this, you're 36, you got your implants at what year?
In 2009.
2009.
Yes.
And this is your one and only set?
Yes.
Okay. Now you got your implants where?
In New Delhi, India.
In New Delhi, India.
Yes.
New Delhi is the capital, correct? Yes. And so now when you got your implants, were you made aware that implants are not lifetime devices, their association with lymphoma, that the breast implant illness?
No, my surgeon had no talk like that. He didn't let me see the implants also. So we didn't discuss. I didn't even know the size.
Mm-hmm.
So he just said that, oh, you are a perfect candidate because you are flat chested. And I was completely flat chested as I am right now after the explant. So he said that, oh, you deserve it because you're not doing it for beauty purpose and all. I said yes, of course. And it was rushed, very rushed. And I was very naive. I didn't know. Just got into it, and then I started getting the symptoms in less than 3 months.
Got it. Now tell me, so what exactly happened after the surgery in 3 months?
So I was in pain, I was in discomfort, and I just kept telling the surgeon that this is it. I'm not breathing.
Which is expected. If you had surgery, you're supposed to be in pain for weeks and months after an augmentation. Which is,
yes.
But what did you feel different otherwise post-op?
Very tight around my chest because I'm very small frame, as you can see. The implants were also very small, but then I didn't know, my body was not reacting well to it. I was not able to breathe. I told that to the surgeon, and he said that you got major surgery, so it is just you will get over it in time. That's what he kept telling me. And
this is the few months after.
Few months after, yes. I didn't start complaining right after a few weeks. I knew that I'm healing. Things will change, But then I had this major gastric issue that I was not getting my motions at all. And it has been.
So you were constipated?
Constipated badly. Like I had everything, the liquids, the syrups that were prescribed. Even sonography was done to see what's going wrong.
They did the ultrasound to see what the problem was?
Yeah. And I went to every other, gastroenterologist, what you call it.
Right, yeah.
And then they said, no, everything looks fine. I had the laxatives and everything, but I was not clear
Now, this is 16 years ago, 2009, 2010,
Yeah.
thereafter. So you had GI issues. What other problems did you have?
Right away, so this was the first major problem that I thought, and then there was continuous, fatigue. It's constant fatigue. So I just thought that maybe I'm stressed or whatever, because you always try to find other reasons for this. So I was not sleeping well, I was not eating well, my mood was all messed up, I was not able to focus or think clearly, so my studies were getting impacted, my work was impacted because of that. So all this just came tumbling over.
Right. Now, what's interesting to note here is this is 16 years ago.
Yes.
16 years ago, and you're 36 now. So 36 minus 16, you were 20.
20, yes.
So you are very young.
Yes.
So just FYI, according to the US guidelines, you cannot get silicone implants unless you're past 22 years of age.
Oh, okay.
So that, according to the guidelines, according to the FDA, so that in itself was according to the US guidelines, a problem. The fact that your surgeon did not share with you the informed consent that what you're signing up for, that they're not lifetime devices. Now, you said it got pretty tight very soon.
Yes.
Tight meaning you had capsular contracture.
Okay.
Is that because that's exactly what you had? You had a grade 3 capsular contracture on the right side and a grade 4 painful contracture on the left side, right? And so this is where, if you just look at the way your chest is and how the nipple was pointing up on the left side and how the implant had gravitated downward and outward, as you saw, because you had what was significant asymmetry. So this started, relatively speaking, very early on.
Early on, yes.
Now look, you had all these 10, 15 years.
Yes.
You lived through all these symptoms.
Yes.
So what were the other subspecialists that you saw?
Everything, like from a neurologist to fibromyalgia. I was told that the joint pain was because of the fibromyalgia.
Mm-hmm.
Then we had this bone specialist, what you call
Orthopedics.
And then they put me through some treatment. And then these usual, stomach issues, I used to go, skin issues, hair issues, I went to so many dermatologists for that. You name it, like I have a bundle of reports and these medical details with me.
Right.
So my trunk is full of that.
Wow, yeah. So now, when did you first hear about breast implant illness?
Yes, I heard about it like a year ago, somewhere floating around. So I said, okay, it might happen to somebody who has, not practiced it well, or something must have gone wrong with them. But then when I started looking at these symptoms and get no answers from the specialists, then I looked deeply into it.
Right. Now remember, this is where you have to go to your doctor, make sure you go see a rheumatologist if you have joint pain issues, rheumatoid arthritis, osteoarthritis. You're too young to have these problems.
Yes.
But again, rheumatoid arthritis, lupus, all these joint problems, ankylosing spondylitis, whatnot else, MS. You had almost all of these symptoms that you had highlighted, and you had been to all the doctors, the dermatologist, like you said, orthopedic surgeon, and they all said everything is normal.
Normal, yes.
Now the blood tests were normal, and this is essentially a diagnosis of exclusion. Now, what led you to believe, okay, you know what, I need to make the move about removing them?
You see, I wanted them removed anyway.
Mm-hmm.
I didn't like them. Like 10 years ago itself, I wanted them to remove. But then I didn't know who to approach, where to go, because I didn't
Did you not go to a local plastic surgeon?
I did go to them, but they were not taking me seriously. So I had no faith in them, to be sorry about it. I was not trusting them. I was not able to, because they were not taking my complaints seriously.
Mm-hmm. No, did you not just ask them to remove the implant?
So they said that we will just remove it and put a new one. I said, if you're saying you put a new one, I do not like them. Why would I want a new one?
Mm-hmm.
Even then, I didn't know that this might be the reason of all my health issues.
Got it. Now you're here all the way in New Delhi or Bangalore, right?
Bangalore, yes.
In India, and you're in front of the computer. At what time did you know what, okay, that you have?
So
Because it's a big deal. Here you
figure
have,
it out.
yeah,
Yes.
So now tell us what was going through your mind, your thought process.
So what happened was I was suffering with all these mysterious things and got no answers. All the health reports were clear, but then I got this inflammation on my left cheek, a big inflammation suddenly out of the blue. I didn't eat anything wrong.
Like a rash.
A rash. It was oozing. It was very, very painful. I had to call in sick. And if I said, if this keeps happening, I'm not living my life. I'm just breathing. I'm not able to commit to my work. I'm not able to commit to my relationships. I'm not able to be with my family. So this cannot continue like this. It has been enough. There has to be some bigger reason to it. And then I started looking into it. So the first thing I went to a dermatologist, of course. She said that consult a rheumatologist. And then this autoimmune thing came into picture. And from autoimmune thing, this connected links to the breast implant illness and the cancer of the immune system and everything. Yeah, I could connect those dots.
So you did it yourself. Did the rheumatologist tell you to get the implants removed?
No.
Okay. So what led you to believe that, okay, I'm going to remove my implants?
These things that, and then I looked into other women talking about this. So I was like, oh, they are telling my story. How do they know about me? What I have went through, like cold fevers, chills, sweatiness, and whatnot, uneasiness all the time, fatigue, brain fog, and cognitive eye issues, and whatnot, fibromyalgia. So everything was like, oh, they are talking about me. So this has to be me, and it could be one person talking like that, 2%. Then I see hundreds of women saying this, the same thing, and then I watched this video of Danica Patrick, and then I was like, oh, this is real. This is not made up. And then
You're not crazy. You're
I'm
not losing
not
it.
crazy.
Yeah.
I studied at the world's best university. I'm not crazy.
No, I will tell you, you're very smart. No, I just want to say this to Danica Kirkpatrick. God bless you, because you have raised a lot of awareness. And to the many other celebrities who have come forth and shared their journey, it takes a lot of effort.
Yes.
And certainly even for you to come forth right now and sit in front of the devices and talk on Instagram, TikTok, Facebook, and YouTube. But this is real. You are real. You are as important as Danica Kirkpatrick and everyone else. And the bottom line here is no one should have to suffer.
Yes.
And so the one thing here is, not there are thousands, there are hundreds of thousands, and I will tell you there are millions of patients out there who are hurting. This weekend alone, for example, this Thanksgiving weekend, I talked to an 88-year-old lady. 1988 is when she got her implants. So she's 88 herself, and she got implants in 1988. And very likely she has what is ruptured silicone implants. And she just listened to one of our Facebook lives, and she got alerted, and she's like, I feel like I've got the same symptoms just like you mentioned, because it's copy paste the same complaints.
Same, exactly the same, to the T.
Yeah, and I remember when I was talking to you, I asked you what % chance do you think you have breast implant illness, and you said 110%, and I said I couldn't agree with you more, even though you were in another part of the world, and I said you have exactly the classic hallmark features of what is breast implant illness. Now, how did you find me?
Oh, that is a very interesting one. So I was just looking at YouTube, I was searching what surgeons do it. I found not a single one in India. Okay, then I thought, I made my mind that I might have to go to some other country to get this done. Then I was looking and looking. So the funny thing is, the most sponsored results will come at the top. And those who are not advertised as much or paid that much are at the bottom, and those are the real results, to be honest. So then I was looking at some random surgeons popped up, and then I saw this your podcast with Maggie McKay. So you were speaking. So just looking at that video, that thumbnail, I thought that there has to be some meaningful in this because the thumbnail itself was very reliable, looked very reliable to me. Then because there was no show off or that glamorous, people try to glamorize it a lot. So I clicked on that video, and that particular video changed everything for me. It was a 29-minute, 24-minute video, your podcast with Maggie McKay, and it clarified everything for me. So that's how I found you. I then took the number from that video itself. I called right away. I spoke with Mar, and less than a month, I got my dates fixed and the visa process and everything. I said I need to get this done.
Right. No, this is where you have no medical background, meaning you are not in the medical field, and you were able to put the two and two together. And this is what I say, be it the 88-year-old nice lady from Oklahoma, or be it the nice 36-year-old from India, you are able to process this. Remember, what is the take-home message? Like, why? Okay, you have all of Dubai, you have all of the Middle East, you have Turkey, you have all of Europe, France, Belgium, Germany, England. You have all these other phenomenal doctors. Like, what is it that brought you here? Like, what is it that convinced you that this is the right place for you?
Trust. I trusted you right away because you were speaking our mind. You were concerned about us, we ladies, and you have been an advocate for this. And you are just a genuine person. You can speak with this person and you can know whether they just want you get something done for the money. They are in it for money. You can sense that. And I tell you that from my experience, you have an inner voice, which is always right. But we try to silence it because our logic and brain takes over it. Oh no, this cannot be. But your inner voice is always right. And my inner voice told me to get it done. Here, come to you.
No, thank you very much. I will tell you, we go through so much in our training, in our mindset, in our philosophy. And if believe it or not, this whole surgery is about the surgeon's personality.
Yes.
It's all about the care, because no one truly knows. Even though you know so much, you still have not much of an understanding what happens into the operating room inside the mind.
Surgeons.
Because there is even another better way, another perfect way, if you will. And this is where we look at your Facebook Live that I did last week on the 26th, and we will put this up. You had the end block on the right and also on the left. You had 5 cc's of fluid on the right, all contained intracapsular, and on the left, 2 cc's of fluid, all contained. All the bad tissue was sincerely removed, leaving behind the precious volume that you have. And this is where how God made you. You do not have much breast tissue, but this is exactly where you are, minus all these years that you had the implants. And now, as you can see, the grade 4 capsular contracture on the left has been addressed, the grade 3 on the right. And that I'm very happy to see that, at least on this, you're very balanced and symmetric. Now, you were very resourceful. Like, you knew what to do, how to do it. You were very calculated, like an engineer, like you're very structured. I like that because you followed my instructions. Even if you look at, you have a gentle tie around. You're all bundled up for this cold weather, but also very systematic and thoughtful. You're listening to my instructions down to the T. You absolutely meet criteria to be heading back home to India tomorrow, have a safe flight back. And this is where, as you head back, you have the peace of mind and confidence that yes, you can make this 18-hour journey, I'm assuming.
Yes, it's more than that.
Yeah, almost 24 hours.
Yes.
So it takes almost 24 hours to get to that part of the world for those who travel frequently. And you can do it very safely. You got the heparin sub-Q shot. You're going to be wearing the compression socks that Natalie is going to help you back on. You've been up and about and walking. You're going to be getting up an hour and a half. You got the twilight deep sedation, so chances of you getting a clot, essentially the same risk that you had coming here. And you have the peace of mind and confidence that all the bad tissue was removed. everything is being checked and processed.
Yes.
You did not get the unnecessary drains. You did not absolutely need that unnecessary lift. And you have the high definition pictures and videos. That is by far the single most important thing. You have those high definition pictures and videos, not only the Facebook Live that was done, but inside you can see
Yes,
your
yes.
chest right and left, because that ultimately tells you as a patient that this is what I signed up for, this is part of the informed consent. You have all good, healthy, viable tissue remaining behind. And as you head back, you have the peace of mind that everything is being tested as well.
Yes.
And then the surgery was done in the purest of manner possible. Now, let me ask you this, how was your anesthesia experience?
Oh, I just felt asleep right away. So I remember Dr. Almar talking to me, and our nurse Emily was asking me questions like, what is your name and what surgery you are going through. And I was just answering those questions. And then she said that you passed the test. And I joked that I've been a good student, I've never failed a test. And I didn't know, I just felt asleep, and the next time I woke up in my bed, I just remember something, getting in the car with my caregiver Natalie and speaking with her, that how is everything. She said everything is fine. That's all I remember. I don't remember anything.
Yes, no, I will say this, we're blessed to have Natalie. She was there from the beginning to the end. She's been
Yes.
driving you back and forth, taking care of you. So yes, you can have the services from a wonderful, caring individual who truly cared for you
Yes.
and was there, before, during, and after till your leave. That truly is a blessing. She is your relative outside of India.
Absolutely.
Yeah.
She is filling in for my father. So my father was supposed to travel with me.
Yeah.
Unfortunately, he couldn't. So she is taking his place in this journey.
Yes. And I will tell you always from my experience, a woman is better than a man when it comes to recovery, because we tend to brush things off. Now, too early to even ask. Now, have you noticed any symptomatic improvement? Now, remember, we're going to do another Facebook Live at 6 months and a year out, just so that we can learn from your experience, because we want not only I to see how you benefited, but the rest of the world to hear, because you're not any more different than the thousands of other patients who have come our way, who have only benefited well over 90% from the symptomatic improvement. So what have you noticed in the last 5 days, ever since your surgery? It was 5 days ago.
Yes. So I was expecting that since this surgery is very involved, so I will have a lot of pain. Luckily, I didn't have any pain at all. A little bit, but it was very much manageable. And I'm breathing very well, which is very, very strange for me. I haven't taken like full lungs breathing for years now. I used to practice yoga breathing exercises, but then I stopped because my chest was so tight. So that is the major improvement. I'm sleeping well. I was told that I will be constipated because of the medications, but uh, in contrast, I'm like doing well.
Right. No, I want to mention you did not get the Exparel.
Yeah.
You did not get the Exparel. And what did you take for pain medications?
Tramadol.
Tramadol, yeah. And how much of the narcotic, the Norco, did you take?
Only one.
Only one.
Yeah.
And how much Tylenol?
That half once, twice a day, half, so once a day, one.
Right.
Yeah.
So I just want to go ahead and emphasize, even though you did not get the Exparel, 70-80% of my patients, now there are a lot of patients who take Exparel. I would if I was getting the surgery, because Exparel really works if you ask me. But majority of the patients, even after looking how invasive the surgeries, you saw those pictures, you truly have a very good 80% of my patients do not need much of the pain medications. And definitely with those quote 2 big sandbags, even though they were 175 cc's each, for your small frame, they were super tight, and you can only imagine how restrictive they were as far as it being able to take a nice deep breath.
Yes.
I will end on this, my end. Implants are not worth the pain and misery at the end that ultimately everyone will have to pay the price. I don't think, maybe there is one patient that I have talked to of the thousands that I have talked to who said that my surgeon told me they're not lifetime devices.
Okay.
The vast majority of the patients unfortunately are told this is not even discussed, and so it's news to them. What the FDA warning was that they're not lifetime devices, and this is very much consistent with what the patients are saying. The longer you have them, the higher the chances are you're going to have problems. Plus minus 7 to 10 years, anecdotally, if you ask me. You want to educate yourself not only about getting implants, if you decide to and you choose to, and I would highly recommend that you go Google this document, breast implants, certain labeling recommendations to improve patient communication, guidance for industry, food and drug administration staff, and actually if you ask me, it should say guidance for patients. And this is where you will see, for example, on this page, you can Google this. On this page 9, you'll see the black box warning. On the next page, you will see the risks of breast implant surgery and all the other problems that one could have. And this is where they want you to initialize, patient initials. And this is truly part of the informed consent. And conversely, when you're getting your implants removed, you want to get the informed consent from the plastic surgeon who's removing them as to how and why she is going to remove them.
Okay.
Your surgeon must be a complete 100% sincere in regards to his or her commitment to removal. He should not be augmenting. He should be giving the implants back to the patient. He should be taking high definition pictures of the chest wall and of cutting open of the implant capsule on the table. The diameter of the implant dictates the incision length, right? We saw a concavity on your chest because of the contracture. You see now, as you will see, the length of time plus minus 4 hours. All of this and the surgeon's website presence, so that if you look at that surgeon, he's not using his partner to getting the augmentation done, so he's able to market himself better. This is where the surgeon is solely, completely, sincerely committed to removal of the capsule. In 20 years from now, I cannot imagine anyone else doing the surgery any differently. If there's any fluid found, it's sent to cytology.
Yes.
If there's the capsular tissue is always sent to pathology. Implants are returned to the patient. Cultures for aerobic, anaerobic, and fungal. No need for the unnecessary drains. No need for the unnecessary lift, twilight, deep sedation. And every person, no matter from the US, from Canada, from India, from Europe, from anywhere, gets the same surgery. And there's complete transparency in this process. And this is where, if you put your mind to it and you understand the process, you should have from your mind and from your heart that content that this is what I want to do. And if you feel like, there's another patient who said, well, I went to another surgeon who said he likes to do general anesthesia because that's safer and better. I will tell you, go to my interview that I did with Dr. Al-Amar and you will hear directly from him which one is safer and better and more practical. You do not want to listen to anyone but the surgeon himself. You do not want to listen to a patient advocate who's just paid to convince you to go to another surgeon. And this person and individual may have no concept of medicine. You do not want to rely on anything except for the high definition pictures and videos and the surgeon's voice as far as how he or she is going to do it. And this is the homework that not only you, but your significant other or the other family members, friends should do, so that you feel that contentment in your heart. In my practice, as you will see, every surgeon should have a Facebook page. You talk about deleting whatnot else, like one of the patients a couple of weeks ago mentioned, look, anyone who's a member of my group can direct DM any of my other previous patients and talk to them. That is transparency, right? Because you're not able to fact check, you can do the check and balance on that surgeon because you're now directly talking to that surgeon's previous patients. What could be more transparent than that? And every surgeon must have their Facebook page so that their previous patients are talking to one another and they have that confidence that everything is being done in the manner described. Yes. And I will let you go ahead and finish, please.
Yeah. So you mentioned about the Facebook page. So this Facebook page is very helpful. Has been very helpful for me to prepare for my travel and to buy stuff that I might need, what to eat and everything. So they have like it's like a uh, very open and transparent place where ladies come and share. They are very compassionate. They also helped me find the caregiver. So I cannot be more thankful. And if this was not there, I would have been doing this all alone. But it didn't feel like I'm doing it alone. I thought that these thousands of ladies are there with me, even though I was like thousands of miles away from them. And also that you said that the surgeon should be transparent. So I would like to add that I believe Dr. Khan more because of the fact how involved he is in the whole process. It is not someone else taking care of the patient or talking to them. It's directly Dr. Khan. He has his personal number given to the patients, and he spoke with me for more than an hour, even before I booked even a single date. So I come from a place where we have to like pay for the consultation, even to look at the one glimpse of the doctor. And here, Dr. Khan is speaking with me for hours, even before knowing that if I will be coming to him or not. So this actually showed how honest and how dedicated he is to his work. So thank you so much.
No, this is what I signed up for. I say this and I'll end with this sarcastically.
Yeah.
If I want, I would triple my salary by putting in implants tomorrow.
Absolutely.
And this is where I have no other interest, do no harm. So I have few things that I live by. This is what my practice is. Number one, do no harm. Implants ultimately, eventually only harm the body because they're not lifetime devices. And again, if I may, read the top line because this kind of summarizes everything for us. This is a very strong verbiage that's used by the FDA. Breast implants, quote unquote, this is the black box warning. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. The other thing I want to mention, the third line, the third point, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. That's you. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution, which means cure of symptoms when the implants are removed without replacement. Do no harm. Don't do something where the patients almost always say two things, if not all. Number one, they wish they had never gotten implants, and they wish they had removed them sooner. Look, for you, it started very soon thereafter.
Yes.
And you kept on thinking it's something else. Number one, do no harm. Number two, D&T, do not touch. If it ain't truly broke, do not hurt the body. And I'm a big fan of D&T, do not touch. And number three, if it ain't broke, don't fix it. And the bottom line here is, it's a very philosophical way, mental way, and it is my approach. And I don't want anyone to follow it, but this is my mindset. God made us all beautiful, and this is where your inner beauty and your outward beauty is the same. You cannot correlate the two. You have to not worry about, and this is me, do not do something that is going to ultimately harm you or hurt you, because that may not be worth what you think you're signed up for, because I use the word misled or misguided or downplayed. And what was the term that you were using before in the consultation? As soon as you said it, I said, guess what, we're doing a Facebook Live. Downplayed, that you were, it was a very nice appropriate word, where your surgeon dismissed you.
Yes.
And so this is where, I tell the patients, do not blame yourself, because if you went to the top hospitals in India, they all will say replace, because it's the 10-15 year. And this is where you're determined and you know that you do not want to sign up for something where if plan A fails, plan B should not be the same as plan A.
Correct.
And so this is the point, and this is the take-home message, and we mean only good will go from our hearts so that when you do get something, you know what you're signing up for, be it cosmetic or patients who have gotten it for oncologic cancer reasons. So thank you very much. Have a safe flight back to India. Thank you, Mar.
Thank you so much.
And we look forward to do another question and answer session possibly later this week. And so we'll be more than happy to address any questions.
Thank you so much.